Do the practices that your therapist tell you to do.
Love it. Yes.
Girl. Practice, practice, practice. Don't give up. It's not enough just to go to your therapy twice a week.
All right, welcome back to the Spero Means Hope podcast, where we take storytelling to a whole new level by sharing amazing patient stories, interview experts in the community, and then share resources for clinicians and students. So today we have with us Adilah. Hi, Adilah.
Hi, how's it going?
Good. How are you doing?
I'm doing good this morning. I already had my first cup of coffee and I'm ready to hydrate now for the rest of the day.
Amazing, amazing. Adilah, can you start by telling us a little bit about yourself? So, where are you from? What do you do for a living? And also, what do you do for fun?
Yeah, so I am from all over. It's very hard to pinpoint where I'm from. When I used to live overseas, I would always say, I'm American. And now that I live in America, I say, I'm from Singapore. But yeah, I grew up overseas, mostly in Southeast Asia. My mom is Singaporean and my dad's American. He's a Texan guy. So we moved to Texas in high school to be closer to my grandparents. And I am a mom of four, married to a veteran, a wonderful man. I am a midwife. And what do I like to do for fun? I like to read and I love to do pottery. So my first degree was in ceramics, so I've never really let go of it.
That is
But so
interesting.
yeah.
What genre of books do you read?
I like to read a lot of like sci-fi stuff. Like I'm that old school Harry Potter girl, you know?
Wow,
So I'm like, yeah, show me all the magic things. Let me leave this world of reality into another world.
that's awesome. You know, I recently told someone I had never watched like Harry Potter and then like nearly had like a heart attack. I know like I need to catch up. I need to catch up.
Yeah, but the movies are nothing like the books, right? It's always the books that's where it's at. And they're making out a new series, a TV series, I think on HBO or Stars for the Harry Potter,
Oh.
which are supposed to be more like closer to the books. So maybe start there. Wait for that to come out.
And then see and go from there.
Yeah.
Oh. And so, Adila, we met through physical therapy. So, can you tell us a little bit about what
Yes.
first brought you to physical therapy?
Yes. So it was a very bizarre scenario, but a blessing, of course. There were just so many things that went well in all of the chaos. I came to physical therapy because I had a craniotomy. So I had brain surgery to remove a tumor that was incidentally found. We had no idea. I had no symptoms of anything, no seizures, no headaches, no nausea. I went into the hospital for a stomach ache. And when they did their CT scans, they decided to do a scan of my brain. So always listen to your nurses, right? But also push for your right, because I was pushing against that. I was kind of like, I don't really think I need the scan of my head. I know I passed out, but I laid down on the floor. There was no like hitting the ground. And the nurses were like, no, we're going to just go ahead and do it. And I was like, oh God, okay, fine. That's fine.
Mhm.
But, thank goodness they did, or else they would not have found that tumor. And I would not have been having brain surgery 5 days later and waking up, um, you know, very unsure of what life was going to look like moving forward. So I had, I don't know, they call it like my doctor. He's so funny. He was like, it's the shape of an egg, but like an organic egg. So it's like a small egg. He was like, not your store bought egg. I was like, oh, okay. He's like,
Homegrown.
yeah, homegrown egg. He's like, that's about the size of the tumor. And it came out of my parietal lobe. So it was number one, wonderful that it was right on the surface and they could remove it. And the parietal lobe controls your senses, right? So your sense of touch, smell, how you see things, and definitely there was a lot of kind of that weird like things don't smell right, things don't taste right
Mm.
for a little bit. But the biggest thing coming out was that I was not really able to move my right side. So it was on the left side of my brain, which controls your right. And so it was very numb for me, very difficult to adjust in the bed. I had to have the nurses constantly come and like kind of pull me up. I had no coordination. My arm would pick up, objects and it would kind of like flop to the side. I had to learn how to walk, right? The first time I walked with the gait and a walker, I literally had to look down at my feet and think, okay, heel, toe, like bend my knee, lift, because I would just drag it and not realize I was doing that. So it was difficult, right?
Yeah.
And the doctor really wanted me to stay in the hospital for a week after surgery, even though I was fine to go home 2 days post-op. But he was like, I want you to get the occupational and physical therapy here. And I was like, oh no, I'm going home. I love you, but I'm calling my people and I will find a way to get this all taken care of. I can't stay in your hospital. I mean, I
gotta
love the
go.
staff. I got to get to my own bed. I've got to, have better food quality. You'd be surprised what the hospital food is like now. And, you would think that we would be a little better in our nutrition, but no,
Yeah.
it was not good. So anyway, so that's what led me to, seeing a friend at home who's a physical therapist, but she specializes in pelvic floor because midwife, right? So I've got all the connections for everything that has to do with your pelvic floor and giving birth and postpartum. But she was coming to my house and helping me, and her son did physical therapy with you guys. And so she was like, you should go check out Spero. You should go see them. And it was just down the street. And so I was really happy that insurance, was able to cover that with you guys and get in. And y'all made it happen like really quick, which was wonderful. I think it was like a week. We got everything approved and I was back into physical and occupational therapy for 6 weeks, or how long was it? I forget. I forget.
A moment in time, like a period of time.
Yeah, I know, right? I'm like 6 weeks sounds like a long time, but maybe it wasn't that long. It was definitely a month. That's
Yeah.
for sure.
Yeah. Yeah.
Yeah.
Your story is interesting in like the ways in which they found the tumor, which I'm so glad that they did. Were they able to resect it at 100%? And then did they give you any insight as to like what could have caused it, or any like hereditary factors or anything like that?
Yes. So I got diagnosed with cancer, right, from the tumor. They actually thought it was a stroke because it looked like an old scar tissue, but it never had signs of a stroke. So they weren't going to really know until they went in and did the biopsy. But the biopsy came back that it was indeed cancer cells. And they call it IDH mutant oliglioma. Something like that. Okay. Lots of fancy words, right? Again, I'm like midwife. I don't know anything up here in the brain. But yeah, so it was a very successful surgery. He told me, he was like, I just couldn't let you sit on it because if it had grown more, it was millimeters away from your movement, your mobility part of the brain, and it would have affected you for life. And so they did a really good job, but now I'm seeing oncology and it's just monitoring it right now. They kind of diagnosed it as a lifelong chronic illness. It's going to be with me forever. There's no really getting rid of it because I guess the way a tumor grows in the brain is that it kind of like has octopus tentacles that kind of spread out, right? So it's hard to get like large margins, which you might hear for other patients that are getting tumors removed from other parts of their bodies and different organs. The brain is very different. But the good thing is, right, again, midwife, I was like, what about pregnancy? What are hormones how is that going to affect the growth of the tumor?
That's a good question.
Yeah, and it doesn't. It's not affected by it. It's not affected by progesterone or estrogen or anything. It's also non-hereditary, they say. It just kind of happens. It's not something that I would like pass down genetically. And the unfortunate thing too, though, is that there is a blood barrier in the brain, which is a very smart technique, right? Tool that our brain uses to protect itself. But there are a lot of things that don't work, treatment wise, that can't get through that barrier. So like people talk a lot about like autoimmune therapy, and that just, it doesn't work for this type. So yeah,
monitoring and just keeping everything at bay.
Yeah, and until, the time comes, it'll be radiation and chemo, and maybe another surgery in the future. But yeah, it's a long-term thing.
Yeah. Yeah.
And the funny thing is that, when I came out of surgery, I kept asking my doctor. I was like, the neurosurgeon. I said, okay, so what is this like numbness feeling going to feel like? Because I still have quite a bit of that tingling numbness, especially in my lower parts. And he told me 1 to 3 years of healing, and he's like, and that's if it goes away,
Mm.
right? So definitely, I've noticed huge improvement. I will never forget when Mercia did my when you did my what do you call it when I first come in, my
Initial evaluation.
yes, and you were
Yes.
like, "Oh, Adilah," like I told her I was like, "I'm a gym girl. Like I go to the gym and I do stuff and I lift weights." She was like, "Oh, you've got strong glutes.
Yeah.
It's really good for you." I'll never forget that. And I was like, "Oh, thank you." Brush off my shoulders. She was like, "That'll get you far." And so I felt like I had made really good improvement in a short
Yeah.
amount of time. I went from going in a walker to a cane to
Yes.
no longer needing those assistants. Running kind of funny, but still learning.
Which I think was really fast because I did your evaluation and then I didn't get to see you for any follow up. But I think the next time I actually saw you in the waiting room, the walker was gone.
I was like,
I was like,
done.
yeah, this girl's gonna go far and very very fast. Which talking about that, can you share some of your like biggest milestones in your recovery, and then also like,
Yeah.
did you struggle with any obstacles, whether like physical or maybe mental, anything like that?
Yeah, I think a lot of it was mental, being able to, um, like I said at the beginning, I was like, I don't know where my life is going to be. I'm a midwife. Like, am I going to be able to catch babies? Am I going to be able to support a mother if I can hardly like support myself and walk? Am I going to be able to do sutures and administer medication if I can't even use my right hand properly? So there was a lot of that mental, like, where is my career and part of who I am? Is that going to disappear?
Mm.
Right? But I had a wonderful village. I mean, there's so many people that rallied around me, and I forgot about that. You build connections and relationships in the birth world, and I have been in it for 10 years. That when this all happened, so many people just came to me and to nourish me and care for me. And the midwives who came assured me, they were just like, Adilah, there's more to being a midwife than just catching babies.
Mm.
We're educators. We help people learn their rights. We give them other options. We give them a different kind of care. And if you can't do a water birth because you can't get in the water because of balance and whatnot, then you just tell clients, well, I'm sorry, with me, we would not be able to do a water birth.
Yeah.
And they're either okay with it or not. And, she said, it's not like we suture all the time. And, another midwife said, yeah, if you need help suturing, that's what we're here for. You call us, right? Your friends to come help you, and we suture, and that's fine. And so that was really comforting. I don't think without just the people that rallied and I was able to talk to, right? Like kind of grieve and talk about all the what ifs and the fears and the doubts, and then have that positive affirmation and talking kind of bounce back to me is what kept me, I think, afloat. Because I think it would have been really easy to fall into this woe onto me,
Yeah.
right? So I think the mental was like the biggest obstacle. Uh, Once, I had my goal set and I was like, nope, I'm going to be stabbing an orange with a syringe
Yes,
with
ma'am.
confidence. And I'm going to be able to do my squats again and carry weights. I will be okay. I'll be okay.
I love that, and I love that you mentioned that like big like midwifery community that rallied around
Yeah.
you. Can you
Yeah.
share more about how you got into midwifery and what like drew you into this profession?
Yeah. So my first pregnancy, I was in New York and I was seeing an OB. And then I had a friend who was also pregnant at the same time. And she was seeing a midwife. And I was like, what is that? And so she told me about this documentary and I went and watched it. It's called The Business of Being Born. And I was very like eye opening. I had my husband watch it, and he was very furious, more at the system. He was just like, oh, I don't know what to believe anymore, right? So we interviewed a midwife. We loved it. The connection was wonderful. And so we had midwifery care of my firstborn. And then after my birth, it was so wonderful. I wanted to also do the same. But I wasn't really quite ready to go back to school yet at that time. So I was like, let me be a doula. So I became a birth doula, and I helped mothers mostly in hospitals, supporting them emotionally and physically and educating them about what their options were in the hospital care. And then I later had all four kids at home with midwifery care. And after the fourth was born, I was like, okay, it's time. It's time for me to
Wow.
go to school and, get this degree and this education and become a midwife for my own community.
Wow. What are some of the main difference between like the treatment approach that a midwife has compared to like traditional like OB/GYN care?
Yeah, so it's very individualized care. Number one, we're not seeing as big numbers as OBGs. Most of them work in big practices, and so they're able to kind of see a lot of patients. Whereas, like on a monthly cycle, we really take about 3 to 5 births a month. So we're really getting to know our clients well. Our appointments are usually an hour long.
Wow.
So again, there's a lot of dialogue of not just, your well-being and baby's well-being and checking on vitals, but it's also a lot of how's life? How are your emotions doing? How's the changes happening? Let's talk about nutrition. Like, what are you eating? Let's do a food log together. You know, there's a lot of education that goes into our appointments as well. And now, as a midwife, right? There's no every. I should go back and say every midwife in each state is allowed to do things differently, right? Because we all have our laws that we have to follow through the state. So in Texas, midwives here are allowed to carry medication. So we carry a lot of the same medications that the OB/GYNs have access to for like hemorrhaging and things like that. Starting IVs, doing suture care, giving oxygen, giving certain things to the baby, like their vitamin K shots and so forth. And also, we're licensed to kind of care for baby up to 6 weeks in postpartum. So measuring baby, make sure baby's gaining the weights. We're doing a lot of breastfeeding care. We're checking on the family as a whole. So yeah, I would say the biggest difference is the individualized care. Now, the other big difference is that we are not surgeons, right? OBGs go to school and they're surgeons first. That's what they're trained in first before they take care of the natural vaginal birth and then go into, women's care. So for us as midwives, right, we can't do surgery at home. It's all home births or birth center births. You do have some midwives that work in hospitals, though, hospital settings where they partner with OBGYNs. But there's only, I think, 2 hospitals here in Houston that do that. So
Oh, that is so interesting. Do you think there are like a lot of misconceptions about like pregnancy and postpartum care in the US?
absolutely. Yes. Me coming from someone who's from Southeast Asia who has very deep roots in postpartum care and traditional and cultural practices, it's almost non-existent here. And that's hard because, we lose the value of the mother and what she brings to our community by raising the children. And a mother who's not mentally doing well isn't going to be the best, self for her in her own life and with her children. So we've got huge depression rates here, right? It's like at 20%.
Wow.
And that's just of the mothers who get diagnosed, right? Because not everyone has the ability to come forward and say something's wrong, or they don't have the care, right? A lot of, we've got big pockets of healthcare in our country. And so moms aren't getting that support or getting that help or those checks because they're really just going to go see the pediatrician, and the pediatrician's just there for the baby,
Yeah.
you know? So moms get overlooked really easily, and those mental illnesses and anxieties set in. Whereas coming from Southeast Asia, it's a very 40 days of complete rest and nourishment, and we take care of the household and the other children, and the mother gets treated, like a queen. And so I think there are some things that are changing. I think since COVID, a lot more women are standing up for their own health and asking for things, right? We're seeing a lot more paternity leave from bigger corporations. And so I think that there are small steps that always go forward, but we're not quite there yet.
Yeah, every time we like the conversation about like paternity leave or maternity leave comes, it's always like it is crazy to think about how like pregnancy and delivery is treated compared to other like surgeries that are not as intensive, and then the type of leave and care and understanding that you get after like any replacement or something like that versus after bringing a whole human into this world. It's
Yeah.
crazy.
Yeah, exactly. It is. So there's a lot of shocking things. Like when people start learning about other countries and the way they care for the families there, and the way they set up family friendly, work and hours and care, people get shocked.
Yeah. I love
So
like listening to you talk about midwifery because I think your passion is very, very evident. And even before we dove deeper, earlier when you were talking about some of the obstacles like post like tumor removal surgery, you talked about how like you had concerns about your profession, and you talked about like identity is a big part of who you are. What would you
yeah.
say is your like absolute favorite thing about being a midwife?
Oh, it's seeing the dads cry.
Aww. Aww.
I love it when, the moms kind of reach this point usually of, I don't know if I can do this. And they kind of look like a deer in the headlights, like, ah.
Aww.
And that's when, things are right there. And these dads sometimes, I mean, they can really step in and be the protector and the lover. And when that child is born, because most of the time our dads are catching the babies. We're really, we're there right behind them,
Aww.
supporting them, of course, and making sure everything's okay. But it is a very special moment. And to see like a father step into that role of bringing his child like to the chest of the mother, being right there with them, and they're like crying, and you're just like, oh, I love it. It's the cycle of life,
Aw, oh my
Everyone
God.
in the room is born. It's not just the baby. Everyone is reborn.
I love that.
So
Is
yeah.
midwifery solely for like low risk pregnancies, or is it something that's
Yes.
accessible? Okay.
Yes, it is for low risk pregnancy. And most women are low risk, right?
Hmm.
Most of us are, eating, as long as we're eating good, taking our supplements, doing our walks, most of us are low risk. But when you start moving into, diabetes,
Yeah.
hypertension, things like that, uh, it gets it gets hard, and so you need higher care. If we talk about preterm labor, that's a transfer to the hospital because your baby's going to need higher care.
Yeah.
So we each, I always tell like families, like, at each prenatal we are measuring, your limits, right? Do we have any pink flags that popped up in this prenatal? Is your blood pressure a little higher? The symptoms that you're feeling, what's going on? Do we need to do a blood draw? Right. So at each prenatal, we are also measuring, is she still safe for an out of hospital birth? And if something comes up, it's nice because we do have, some of those partnerships where we work with like maternal fetal medicine doctors who
Yeah.
specialize in high risk. So we might send someone in over there to an MFM and say, hey, can you, tell us your opinion on this and what you see? And does she risk out of care? Or is she still able to have a out of hospital birth? And so sometimes MFMs will work with us to keep tabs on moms, to make sure that they're still healthy and baby's still doing good for an out of hospital birth. But yes, it is for the normal average pregnancy.
Yeah. Low risk. Okay. All
Yeah.
right. Thanks for educating on that because I think like sometimes people don't even know that that's even an option, and so I think
Yeah.
that's really good information you're bringing out there.
Yeah, it is. And a lot of people, midwifery, some insurances will cover it now. I feel like since COVID, because a lot of people wanted to out of hospital births and they were scared of the hospitals, right? So a lot of insurance started covering birth center births, certified nurse midwives births, and some certified professional midwives. It depends. But it's about kind of the same, I would say, as your deductible.
Mm.
So like, I always talk about that because it is an out-of-pocket expense. So you're looking at probably about 6 to 7 thousand
Yeah.
for your out-of-hospital birth. But like I said, sometimes it's about the same as a deductible.
That's good to know, like regarding options.
Yeah, absolutely. It's always good for our moms, in Houston and everywhere to know that they always have options in their birth. And some women can even do co-care, like where they have to give birth in a hospital, but they get all their prenatal and postpartum care with a midwife, right, out of hospital, because we tend to offer a little bit of that safer space. It's more homey, you're not walking so much into a clinic space with bright lights. We don't have the white coat. We really try not to let our moms get that white coat syndrome where people, have high blood pressure because they're just worried walking into a new space. It's sterile and you kind of smell all the things. Not that we're burning sage at the door, but but I do think that we bring in a little bit more like safe space because of the home vibe. So getting care in your home or getting care in an office with a midwife, some moms offer that, but they'll still birth in a hospital.
And I do like that you said earlier that the visits are about 1 hour, because I do think that that's one of the drawbacks of like traditional care is sometimes that time is just very limited.
Yeah, it
Yeah.
is. And it's hard to build that connection of communication and trust, right?
Yeah.
That's ultimately what we want because birth is very intimate, right? We have a baby like we make a baby. So we need to make sure that the space feels good vibes, good energy, good communication. And there needs to always be trust between the provider and the patient.
Yeah. Adila, do you
Just
have?
like you guys, trust fall.
Yeah,
I knew
that
you
is very
guys would
true.
like catch me if I fell.
That is very true. We got you. We got you. Do you have any
Yeah.
advices for anybody listening that's interested in like maybe a career in midwifery? Like any advices for them?
Yeah, I would, number one, go to all the birthy events and get to know all the midwives. And then number two, go find, I preferred the school route. Some people do what we call PEP route, which is like self-taught, and they do most of their work through internships,
Oh
right?
wow.
And being under another midwife, being a student with another midwife. But I preferred the school route because I needed something to kind of keep me on track. I needed those classes. I needed, to see my instructors face to face. And so I did that. And there's a really good school in Utah. There's a really good school. I went to Wisconsin. And there's not that many schools that give midwifery degrees, but I think there's three. I'm just forgetting what the third one. I think there's another one in Florida. So I would always suggest going to that. It is a little bit more of an investment, but I do think it keeps you on track. Because sometimes some midwives, it takes them about like 5 to 10 years to finally kind of become the licensed midwife.
Wow.
So I guess it depends on the track you're looking for in your family dynamic as well.
Those are good advices. And then earlier you mentioned like whenever you got diagnosed, you had such a big community really around you. I like to give people the opportunity to give shout outs. So if you had like a thank you list, whether it's like
Yeah.
professional or personal, like who would you
Oh my
like to
gosh.
extend a big
My
shout out
shout
to?
out is so big. Okay. So I got to go through number one. I got to go through all the providers that helped me, right? Not only you guys, my therapist at Spero, but so I had a few different occupational therapists, and then Derek was mostly just my physical therapy. And then I also did acupuncture once to two
Oh,
times a week. Which I think I didn't. I stopped during the summertime, and my numbness has gotten worse. So I feel I need to go back to acupuncture
that
because I
is
think it was
so
really helping.
interesting.
Yeah, and so I saw Dr. Jordan. Well, I have a point for that, and I also saw Dr. Kathleen Funk at acupuncture, and then I saw Dr. Lauren Collins for cranial therapy and chirotherapy. She is over at Abound Chiropractic, and then I had like three different massage therapists that were coming rotating into my house. So I had my awesome Natasha. I had this old school Indonesian lady who actually did my postpartum treatments with my second born. She came back
Aww.
to see me for this one. Yeah. And she was giving me all of like the rainforest herb medications. She's like, take this. This is going to get rid of inflammation and all the things. And I was like, yes, give it to me. And then, of course, Dr. Alyssa, who was at West Pelvic. She was the original physical therapist who came and helped me in my house. and oh my gosh, and then all of my friends, and then all of my family, like I just all the people, all the midwives that I've worked with, Patty and Sherry. I mean, those girls kidnapped me one day for lunch. They set it up with my husband, which was really sweet. So I
Aw.
appreciate everyone who has cooked for me, brought me food, took my kids out, brought them snacks, all the things. Yeah,
I love
I'm
that.
very appreciative.
I love that. And then hearing your provider list, I'm realizing like how you really took a holistic approach to healing, which not everybody does. So I like that. So you mentioned acupuncture. Like, can you talk a little bit about some of the benefits that you saw with acupuncture?
Yeah, so I saw pain relief. I had this like sore, sharp pain kind of on my right shoulder that developed later after surgery with exterior rotation. And I'm telling you that she did a point in my leg and it went away almost instantly.
Wow.
But she was also really helping me with my digestion, with my sleep, with my kind of just balancing in the body, with my blood flow. So my blood flow was very strong on my right side and very weak on my left. And you could even feel like the temp difference. You could tell like my right leg was really warm compared to my left. And I would guess that's just from healing and the body's trying to heal one side versus the other. And so helping my blood flow kind of balance out. But I've had acupuncture done in the past for like postpartum anxiety, for hormone balancing. I had horrible acne about a year after I gave birth to my fourth, and I had insomnia. So it helped me with all of those things and cleared it all up for me as well. So I love acupuncture.
Wow. And then massage therapy, was that also, you mentioned the little Indonesian lady, she was part of your postpartum care. Is that something you
Yes.
consistently do, like postpartum?
Yeah. So in postpartum in the Malay culture, it's you're getting a massage almost every week.
Wow.
For 6 weeks, and so is baby. It's very important to massage our baby. We usually the baby's being massaged every day, and then there's a lot of like herbal treatments on the body scrubs, belly masks, hair, scalp treatments that are done in postpartum, keeping the mother very warm. So there's also a whole like kind of nutrition side to what you should be eating, what you shouldn't be eating,
Wow.
right? Like our cold foods versus our warm foods. There are certain fruits that you would eat in pregnancy that you wouldn't eat in postpartum. So following those things as well. Yeah.
So interesting. I feel like I could talk to you for hours about this, 'cause especially I like how you experience like living abroad also brings like this like cross cultural aspect to how like care is and care should be. It's very interesting.
Yeah, I've really enjoyed, I'm really blessed to be able to have lived overseas for most of my childhood and really getting to know different cultures and understanding that everyone has a different way of life. And it doesn't mean there's one right way or wrong way. It's just all different. And we can learn so many things from each other, right? If we just get out a little bit and talk to one another.
I love that. Adila, is
Yeah.
there anything I haven't asked you about that you wanted to mention or any like last minute words of wisdom?
Um, my words of wisdom are do the practices that your therapist tell you to do.
Love it. Yes.
Girl, do that stuff. I'm telling you, because whatever I was doing in the clinic space, I was doing at the gym. I was finding my tools and I was getting it done because I was on a mission to be able to get out of the walker, off the cane, and walking upstairs and down the stairs without any problems. So practice, practice, practice. Don't give up. It's not enough just to go to your therapy twice a week.
Like, ah, you're amazing. You're amazing. I'm gonna save this as a sound bite, sending to my patients after initial evaluation. I love it. Adila, thank you so much for taking the time to have this conversation with me and sharing like not only your personal training experience, but then also like all things midwifery. I thought it was very, very
Absolutely.
interesting and fascinating.
Yeah, thank you for having me. And you guys can check me out on Instagram
Yes, yes.
for, yes, come check me out on Instagram because I give a lot of postpartum tips. I get a lot of, educational facts on there for pregnancy and postpartum. It's Ibu_Adilah. So you can
Yep.
find me there.
And I'll add that to the show notes. And then also that's where they can also find out about your practice and like how to get care with you.
Yes. Yes, absolutely.
Perfect. And then you mentioned insurance provides some reimbursement or for midwifery care?
Yeah, so a lot of times if you have insurance, you can get all of your lab work and ultrasound paid for through insurance. I work with a CNM, so she's also able to do prescriptions and like problem solving, like wellness visits, IUD insertions, birth control, pap smears. We do all of that stuff, hormone checking out, blood draws for that. So most of the time you can get those tests and of course the medication through insurance, and then out of pocket pay for our visits.
Awesome. Thanks for the information, and I'll make sure I add all of that so people can reach out to you.
Yes, thank you so much, Mercia. Well, I hope you have a good rest of your day.
Thank you.